Welcome. In this video, you'll tackle 50 of the most failed NCLEX questions on beta blockers, digoxin, and nitroglycerin. These high-risk cardiac medications are packed with exam traps involving toxicity, contraindications, priority interventions, and patient teaching. Challenge yourself, think like an NCLEX test taker, and see how many you can answer correctly before the explanations. Question 1. A nurse is preparing to administer the morning medications to 4 clients on a telemetry unit. Which client should the nurse assess first before administering the scheduled dose of digoxin? A. A client whose apical heart rate is 54 beats/minute and reports nausea since breakfast. B. A client with heart failure whose blood pressure is 128/76 mm Hg and reports increased urination overnight. C. A client with atrial fibrillation whose ventricular rate is 94 beats/minute and reports mild fatigue after physical therapy. D. A client with chronic stable angina whose serum potassium level is 4.3 milliequivalent/L and heart rate is 72 beats/minute. Answer. A. A client whose apical heart rate is 54 beats/minute and reports nausea since breakfast. Rationale. Digoxin should be withheld when the apical pulse is below 60 beats/minute in adults. Bradycardia combined with nausea is highly suggestive of digoxin toxicity and requires immediate assessment. Question 2. A client receiving intravenous metoprolol for rapid atrial fibrillation suddenly develops dizziness. Assessment reveals a blood pressure of 84/48 mm Hg, heart rate of 42 beats/minute, respiratory rate of 18 breaths/minute, and oxygen saturation of 97% on room air. Which action should the nurse perform first? A. Administer the next scheduled dose after encouraging oral fluids. B. Stop the medication infusion and notify the healthcare provider immediately. C. Place the client in high Fowler's position. D. Encourage the client to ambulate slowly. Answer. B. Stop the medication infusion and notify the healthcare provider immediately. Rationale. Severe hypotension and marked bradycardia are adverse effects of beta blockers requiring immediate discontinuation and provider notification. Question 3. A client prescribed sublingual nitroglycerin for chronic stable angina states. I took 1 tablet this morning and immediately swallowed it because it tasted bitter. Which response by the nurse is most appropriate? A. Swallowing the medication improves absorption. B. The medication should dissolve under your tongue without swallowing. C. You should chew the tablet before swallowing. D. Take the medication with food to decrease stomach irritation. Answer. B. The medication should dissolve under your tongue without swallowing. Rationale. Sublingual nitroglycerin must dissolve under the tongue for rapid absorption. Swallowing significantly reduces its effectiveness. Question 4. A client receiving digoxin for heart failure develops hypokalemia after several days of loop diuretic therapy. Which finding concerns the nurse most? A. Serum potassium of 2.9 milliequivalent/L. B. Mild bilateral ankle edema. C. Weight gain of 0.5 kilograms. D. Blood pressure of 138/82 mm Hg. Answer. A. Serum potassium of 2.9 milliequivalent/L. Rationale. Hypokalemia greatly increases myocardial sensitivity to digoxin, significantly increasing the risk of life-threatening toxicity. Question 5. The nurse is teaching a client beginning propranolol therapy. Which client statement indicates a need for additional teaching? A. I will check my pulse before taking the medication. B. I should avoid stopping this medication suddenly. C. This medication may hide signs of low blood sugar. D. If I feel better, I can stop taking it without consulting my provider. Answer. D. If I feel better, I can stop taking it without consulting my provider. Rationale. Abrupt withdrawal of beta blockers may precipitate rebound hypertension, tachycardia, or myocardial infarction. Question 6. A client with angina reports persistent chest pain after taking 1 sublingual nitroglycerin tablet. Which instruction should the nurse provide? A. Wait 30 minutes before taking another tablet. B. Take a second tablet after 5 minutes and call emergency medical services if pain persists. C. Double the dose immediately. D. lie flat and avoid taking additional medication. Answer. B. Take a second tablet after 5 minutes and call emergency medical services if pain persists. Rationale. Nitroglycerin may be taken every 5 minutes for up to 3 doses. Emergency services should be activated if chest pain continues. Question 7. The nurse reviews laboratory results for a client taking digoxin. Which result places the client at the greatest risk for toxicity? A. Serum magnesium 1.1 mg per deciliter. B. Hemoglobin 13.8 g/dl. C. Sodium 139 milliequivalent/L. D. Calcium 9.1 mg per deciliter. Answer. A. Serum magnesium 1.1 mg per deciliter. Rationale. Hypomagnesemia increases the risk of digoxin-induced dysrhythmias and toxicity. Question 8. Which assessment finding requires the nurse to question a prescription for atenolol? A. History of asthma requiring rescue inhaler, used several times weekly. B. Controlled hypertension. C. Heart rate of 82 beats/minute. D. Blood pressure of 146/88 mmHg. Answer. A. History of asthma requiring rescue inhaler, used several times weekly. Rationale. Even cardioselective beta blockers may worsen bronchospasm in clients with reactive airway disease. Question 9. A client using transdermal nitroglycerin asks why the patch is removed each evening. Which response by the nurse is correct? A. Removing the patch prevents skin irritation only. B. A daily nitrate-free interval helps prevent tolerance. C. The medication works only during daylight hours. D. Nitroglycerin becomes toxic after 12 hours. Answer. B. A daily nitrate-free interval helps prevent tolerance. Rationale. Continuous nitrate exposure leads to tolerance. A daily nitrate-free interval helps preserve effectiveness. Question 10. The nurse is caring for a client receiving digoxin who suddenly reports blurred vision and seeing yellow halos around lights. Which nursing action is the priority? A. Administer the next scheduled dose. B. Assess the apical pulse and withhold the medication while notifying the healthcare provider. C. Encourage increased fluid intake. D. Place the client in Trendelenburg position. Answer. B. Assess the apical pulse and withhold the medication while notifying the healthcare provider. Rationale. Visual disturbances such as yellow halos are classic signs of digoxin toxicity. The medication should be withheld, the apical pulse assessed, and the provider notified promptly. Question 11. A nurse is caring for a client with chronic heart failure who receives digoxin 0.125 mg orally each morning and furosemide 40 mg twice daily. During morning assessment, the client reports poor appetite, nausea, and generalized weakness. Vital signs include blood pressure 118/70 mmHg, apical pulse 56 beats/minute, respiratory rate 18 breaths/minute, and oxygen saturation 97% on room air. Which nursing action is the priority? A. Administer both medications because the blood pressure is stable. B. Hold the digoxin, assess for additional signs of toxicity, and notify the healthcare provider. C. Give furosemide first and administer digoxin 1 hour later. D. Encourage the client to eat breakfast before taking the medications. Answer. B. Hold the digoxin, assess for additional signs of toxicity, and notify the healthcare provider. Rationale. An apical pulse below 60 beats/minute accompanied by nausea and weakness strongly suggests digoxin toxicity. The medication should be withheld pending further evaluation. Question 12. A client taking metoprolol for hypertension tells the nurse, "Since starting this medication, I don't notice my heart racing when my blood sugar gets low." Which interpretation by the nurse is most appropriate? A. The medication is effectively controlling hypertension and blood glucose. B. Beta blockers can mask adrenergic symptoms of hypoglycemia, increasing the risk for severe hypoglycemia. C. The client is developing tolerance to metoprolol. D. This finding indicates an allergic reaction to the medication. Answer. B. Beta blockers can mask adrenergic symptoms of hypoglycemia, increasing the risk for severe hypoglycemia. Rationale. Beta blockers can suppress tachycardia and tremors, making hypoglycemia harder to recognize, particularly in clients with diabetes. Question 13. A client with chronic stable angina takes one sublingual nitroglycerin tablet for chest discomfort. 5 minutes later, the pain remains unchanged and is rated 8 out of 10. Which action should the nurse instruct the client to take next? A. Take a second nitroglycerin tablet and activate emergency medical services. B. Wait another 15 minutes before taking another tablet. C. Drink a full glass of water before taking another dose. D. Lie down and take the next dose in 1 hour. Answer. A. Take a second nitroglycerin tablet and activate emergency medical services. Rationale. Persistent chest pain after the first nitroglycerin dose may indicate acute coronary syndrome. Emergency medical services should be contacted while continuing the prescribed dosing schedule. Question 14. A nurse reviews laboratory results for 4 clients receiving digoxin. Which client is at the greatest risk for developing digoxin toxicity? A. Serum potassium 2.8 milliequivalent/L. B. Serum sodium 141 milliequivalent/L. C. Serum chloride 103 milliequivalent/L. D. Serum bicarbonate 25 milliequivalent/L. Answer. A. Serum potassium 2.8 milliequivalent/L. Rationale. Hypokalemia significantly increases the binding of digoxin to myocardial cells, greatly increasing the risk of toxicity and dysrhythmias. Question 15. A client receiving propranolol develops wheezing, shortness of breath, and diminished breath sounds shortly after receiving the scheduled dose. Which action should the nurse take first? A. Administer the next scheduled dose early. B. Hold the medication and assess the client's respiratory status immediately. C. Encourage coughing and deep breathing. D. Place the client in Trendelenburg position. Answer. B. Hold the medication and assess the client's respiratory status immediately. Rationale. Propranolol is a non-selective beta blocker that can precipitate bronchospasm. Respiratory assessment and withholding the medication are priority actions. Question 16. A client using transdermal nitroglycerin reports dizziness immediately after standing from a chair. Which instruction should the nurse provide? A. Stand up quickly to improve circulation. B. Rise slowly and sit or lie down if dizziness occurs. C. Remove the nitroglycerin patch permanently. D. Increase caffeine intake to prevent dizziness. Answer. B. Rise slowly and sit or lie down if dizziness occurs. Rationale. Nitroglycerin commonly causes orthostatic hypotension. Slow position changes reduce the risk of falls and syncope. Question 17. A nurse is preparing to administer digoxin to an older adult with heart failure. Which assessment finding requires withholding the medication? A. Apical pulse of 58 beats/minute. B. Respiratory rate of 20 breaths/minute. C. Blood pressure of 132/76 mmHg. D. Oxygen saturation of 96% on room air. Answer. A. Apical pulse of 58 beats/minute. Rationale. Digoxin should generally be withheld when the adult apical pulse is below 60 beats/minute, and the healthcare provider should be notified. Question 18. A client taking carvedilol asks why the medication should be taken with food. Which response by the nurse is most accurate? A. Food improves absorption and decreases the risk of orthostatic hypotension. B. Food prevents the medication from causing kidney damage. C. The medication is ineffective if taken on an empty stomach. D. Taking it with food prevents hypoglycemia. Answer. A. Food improves absorption and decreases the risk of orthostatic hypotension. Rationale. Taking carvedilol with food slows absorption and reduces the likelihood of symptomatic orthostatic hypotension. Question 19. A client receiving intravenous nitroglycerin suddenly develops a blood pressure of 78/44 mmHg while chest pain has completely resolved. Which nursing action is the priority? A. Increase the infusion rate. B. Reduce or stop the nitroglycerin infusion according to protocol and notify the healthcare provider. C. Encourage the client to ambulate. D. Administer the next scheduled beta blocker immediately. Answer. B. reduce or stop the nitroglycerin infusion according to protocol and notify the healthcare provider. Rationale: severe hypotension is a significant adverse effect of intravenous nitroglycerin and requires immediate intervention to prevent organ hypoperfusion. Question 20. A nurse is evaluating teaching provided to a client prescribed digoxin. Which statement by the client demonstrates correct understanding? A. If I miss a dose, I'll take 2 tablets the next time. B. I'll check my pulse before taking the medication and report a pulse below the prescribed limit. C. I'll stop taking digoxin once my swelling improves. D. I'll take extra doses whenever I feel my heart beating fast. Answer: B. I'll check my pulse before taking the medication and report a pulse below the prescribed limit. Rationale: clients taking digoxin should monitor their pulse before each dose, withhold the medication if instructed, commonly for a pulse below 60 beats/minute in adults, and notify their healthcare provider. Doubling doses or stopping the medication without medical advice is unsafe. Question 21. A nurse is preparing to administer the morning medications to a client with chronic heart failure. The client receives digoxin 0.125 mg daily, furosemide 40 mg twice daily, and lisinopril 10 mg daily. The client's apical pulse is 62 beats/minute. Serum potassium is 2.7 milliequivalent/L. Serum digoxin level is pending, and the client reports nausea and blurred vision. Which nursing action is the priority? A. Administer all medications as prescribed because the apical pulse is above 60 beats/minute. B. Hold the digoxin and notify the healthcare provider immediately. C. Administer furosemide first to reduce fluid overload. D. Encourage the client to eat before taking digoxin. Answer: B. Hold the digoxin and notify the healthcare provider immediately. Rationale: although the apical pulse is acceptable, severe hypokalemia with nausea and blurred vision strongly suggests impending digoxin toxicity. Digoxin should be withheld and the provider notified. Question 22. A client prescribed metoprolol for hypertension asks why the nurse checks the heart rate before each dose. Which response is most appropriate? A. The medication can cause significant bradycardia that may require withholding the dose. B. The medication increases the heart rate before lowering blood pressure. C. The medication is effective only when the pulse exceeds 100 beats/minute. D. The medication commonly causes irregular respirations. Answer: A. The medication can cause significant bradycardia that may require withholding the dose. Rationale: beta blockers slow sinoatrial node activity and may produce symptomatic bradycardia requiring dose adjustment or withholding the medication. Question 23. A client with chronic stable angina reports taking 3 sublingual nitroglycerin tablets over 15 minutes with no relief of chest pain. Which nursing action is the highest priority? A. Encourage the client to rest for another 30 minutes. B. Activate emergency medical services immediately. C. Administer an additional nitroglycerin tablet. D. Instruct the client to schedule a provider appointment the following day. Answer: B. Activate emergency medical services immediately. Rationale: chest pain unrelieved after 3 doses of nitroglycerin may indicate an acute myocardial infarction requiring emergency intervention. Question 24. A nurse is assessing a client receiving propranolol. Which finding requires immediate intervention? A. Blood pressure of 86/50 mm of mercury and heart rate of 42 beats/minute. B. Mild fatigue after walking. C. Heart rate of 68 beats/minute. D. Blood pressure of 128/78 mmHg. Answer: A. Blood pressure of 86/50 mm of mercury and heart rate of 42 beats/minute. Rationale: severe hypotension with marked bradycardia indicates excessive beta blockade and requires immediate intervention. Question 25. A client taking digoxin states, "Food tastes different lately, and I haven't wanted to eat." Which nursing action is most appropriate? A. Document the finding as an expected age-related change. B. Assess for additional manifestations of digoxin toxicity and notify the healthcare provider. C. Recommend increasing dietary sodium intake. D. Encourage the client to skip today's dose only. Answer. B. Assess for additional manifestations of digoxin toxicity and notify the healthcare provider. Rationale. Anorexia and altered taste may be early manifestations of digoxin toxicity, particularly in older adults. Question 26. A client prescribed transdermal nitroglycerin asks where to apply the patch. Which instruction by the nurse is most appropriate? A. Apply the patch to a clean, hairless area of the upper body and rotate application sites. B. Apply the patch over the area where chest pain occurs. C. Place the patch on the lower leg to improve circulation. D. Apply each new patch directly over the previous site. Answer. A. Apply the patch to a clean, hairless area of the upper body and rotate application sites. Rationale. Rotating clean, hairless application sites promotes consistent drug absorption and reduces skin irritation. Question 27. A nurse is caring for a client receiving carvedilol. Which assessment finding requires the greatest concern? A. Wheezing with prolonged expiration. B. Heart rate of 68 beats/minute. C. Blood pressure of 122/74 mmHg. D. Mild fatigue after exercise. Answer. A. Wheezing with prolonged expiration. Rationale. Carvedilol has non-selective beta-blocking effects that may precipitate bronchospasm, especially in susceptible clients. Question 28. A client receiving digoxin develops new-onset confusion, weakness, nausea, and an irregular pulse. Which action should the nurse perform first? A. Administer the scheduled digoxin dose. B. Obtain an apical pulse, withhold digoxin, and notify the healthcare provider. C. Encourage oral fluids. D. Place the client in high Fowler's position. Answer. B. Obtain an apical pulse, withhold digoxin, and notify the healthcare provider. Rationale. Confusion, gastrointestinal symptoms, weakness, and dysrhythmias are classic findings of digoxin toxicity and require immediate evaluation. Question 29. A client prescribed atenolol says, "I feel tired since starting this medication." Which response by the nurse is most appropriate? A. Fatigue is a common effect when starting beta-blocker therapy and often improves with time. B. This means the medication is damaging your heart. C. Stop taking the medication immediately. D. Take twice the prescribed dose tomorrow. Answer. A. Fatigue is a common effect when starting beta-blocker therapy and often improves with time. Rationale. Mild fatigue commonly occurs when initiating beta-blocker therapy because of reduced heart rate and cardiac output, and it often lessens as the body adapts. Question 30. A client using sublingual nitroglycerin carries the tablets in a weekly pill organizer. Which nursing instruction is most appropriate? A. Continue storing the tablets in the organizer for convenience. B. Store the tablets in their original dark glass container with the lid tightly closed. C. Refrigerate the tablets after opening the bottle. D. Crush the tablets before carrying them. Answer. B. Store the tablets in their original dark glass container with the lid tightly closed. Rationale. Sublingual nitroglycerin is sensitive to light, heat, air, and moisture. Keeping the tablets in their original tightly closed dark glass container preserves their potency. Question 31. A nurse is caring for 4 clients receiving cardiac medications. Which client should the nurse assess first? A. A client taking digoxin who reports nausea, blurred vision, and seeing yellow halos around lights. B. A client taking metoprolol whose blood pressure is 108/68 mmHg and heart rate is 64 beats/minute. C. A client using a nitroglycerin patch who reports a mild headache rated 2 out of 10. D. A client taking carvedilol who reports mild fatigue after walking 100 feet. Answer. A. A client taking digoxin who reports nausea, blurred vision, and seeing yellow halos around lights. Rationale. Gastrointestinal symptoms and visual disturbances, yellow halos, are classic signs of digoxin toxicity and require immediate assessment and intervention. Question 32. A client with heart failure receives digoxin and furosemide. Which laboratory result requires immediate intervention before administering the morning medications? A. Potassium 2.6 milliequivalent/L. B. Sodium 139 milliequivalent / L. C. Calcium 9.4 milligrams per deciliter. D. Magnesium 2.0 milligrams per deciliter. Answer: A. Potassium 2.6 milliequivalent / L. Rationale: severe hypokalemia greatly increases the risk of digoxin toxicity and life-threatening dysrhythmias. Question 33. A client taking propranolol for hypertension suddenly develops diaphoresis, confusion, and a blood glucose level of 42 milligrams per deciliter. Which statement best explains why the client delayed seeking treatment? A. Propranolol masks many of the adrenergic warning signs of hypoglycemia. B. Propranolol increases insulin production. C. Propranolol prevents glucose absorption from food. D. Propranolol causes hyperglycemia before hypoglycemia develops. Answer: A. Propranolol masks many of the adrenergic warning signs of hypoglycemia. Rationale: beta blockers can suppress tachycardia and tremors, delaying recognition of hypoglycemia. Question 34. A client is prescribed sublingual nitroglycerin for chronic stable angina. Which client statement indicates correct understanding of medication administration? A. I'll place the tablet under my tongue and allow it to dissolve completely. B. I'll chew the tablet before swallowing it. C. I'll take the tablet every morning whether I have chest pain or not. D. I'll keep the tablets in my bathroom medicine cabinet. Answer: A. I'll place the tablet under my tongue and allow it to dissolve completely. Rationale: sublingual nitroglycerin must dissolve under the tongue for rapid absorption and relief of angina. Question 35. A client receiving intravenous metoprolol develops a heart rate of 38 beats/minute and becomes dizzy. Which prescription should the nurse anticipate? A. Administer atropine. B. Increase the metoprolol infusion. C. Administer an additional beta blocker. D. Begin a vigorous exercise program. Answer: A. Administer atropine. Rationale: symptomatic bradycardia caused by beta blockers is commonly treated with atropine while the beta blocker is withheld. Question 36. A nurse is reinforcing teaching for a client prescribed a nitroglycerin transdermal patch. Which statement by the client requires further teaching? A. I'll remove the old patch before applying a new one. B. I'll rotate where I place the patch. C. I'll wear the patch continuously every day without removing it. D. I'll apply the patch to clean, dry skin. Answer: C. I'll wear the patch continuously every day without removing it. Rationale: continuous nitrate exposure leads to tolerance. A daily nitrate-free interval is necessary to maintain effectiveness. Question 37. A client receiving digoxin develops frequent premature ventricular contractions on the cardiac monitor. Which laboratory result would the nurse expect to contribute to this finding? A. Potassium 2.9 milliequivalent / L. B. Sodium 140 milliequivalent / L. C. Chloride 101 milliequivalent / L. D. Bicarbonate 24 milliequivalent / L. Answer: A. Potassium 2.9 milliequivalent / L. Rationale: hypokalemia enhances digoxin's effects on the myocardium, increasing the risk of ventricular dysrhythmias. Question 38. A nurse is teaching a client who has been prescribed atenolol. Which client statement requires immediate correction? A. I will check my pulse before taking the medication. B. If I begin wheezing, I'll contact my healthcare provider. C. I'll stop taking the medication if my blood pressure becomes normal. D. I'll change positions slowly to reduce dizziness. Answer: C. I'll stop taking the medication if my blood pressure becomes normal. Rationale: beta blockers should never be discontinued abruptly because rebound hypertension, tachycardia, and myocardial ischemia may occur. Question 39. A client using sublingual nitroglycerin experiences severe dizziness immediately after taking a dose. Which nursing action is most appropriate? A. Instruct the client to sit or lie down immediately. B. Encourage brisk walking. C. Administer another nitroglycerin tablet. D. Drink coffee to increase blood pressure. Answer: A. Instruct the client to sit or lie down immediately. Rationale: nitroglycerin can cause significant vasodilation and orthostatic hypotension, increasing the risk of falls and syncope. Question 40. A nurse is caring for a client taking digoxin whose serum digoxin level is 3.1 nanograms per milliliter. The client reports nausea, vomiting, confusion, and blurred vision. Which action is the priority? A. Administer the scheduled dose of digoxin. B. Withhold digoxin, notify the healthcare provider immediately, and prepare for possible administration of digoxin immune fab if prescribed. C. Encourage increased oral fluid intake. D. Reassure the client that these findings are expected. Answer. B. Withhold digoxin, notify the healthcare provider immediately, and prepare for possible administration of digoxin immune fab if prescribed. Rationale: a markedly elevated digoxin level with clinical manifestations of toxicity requires immediate discontinuation of the medication, prompt provider notification, and possible administration of digoxin immune fab. Question 41. A nurse is preparing to administer the morning medications to a client with heart failure. The client receives digoxin, furosemide, and spironolactone. Assessment reveals an apical pulse of 58 beats/minute, nausea, decreased appetite, and a serum digoxin level of 2.5 nanograms per milliliter. Which action should the nurse take first? A. Administer all medications as prescribed. B. Hold the digoxin and notify the healthcare provider immediately. C. Administer the furosemide before the digoxin. D. Encourage the client to eat breakfast before taking medications. Answer. B. Hold the digoxin and notify the healthcare provider immediately. Rationale: an elevated digoxin level, bradycardia, and gastrointestinal symptoms are consistent with digoxin toxicity. The medication should be withheld and the provider notified promptly. Question 42. A client taking carvedilol for heart failure is admitted with an acute asthma exacerbation. Which nursing action is most appropriate? A. Administer the carvedilol as prescribed. B. Hold the carvedilol and immediately notify the healthcare provider. C. Encourage the client to ambulate to improve ventilation. D. Administer the carvedilol with food to reduce respiratory symptoms. Answer. B. Hold the carvedilol and immediately notify the healthcare provider. Rationale: carvedilol is a non-selective beta blocker that can worsen bronchospasm during an acute asthma exacerbation. Question 43. A client with stable angina reports taking sildenafil 6 hours ago and is now experiencing chest pain. Which action by the nurse is most appropriate? A. Administer sublingual nitroglycerin immediately. B. Withhold nitroglycerin and notify the healthcare provider immediately. C. Administer 2 nitroglycerin tablets simultaneously. D. Apply a nitroglycerin transdermal patch. Answer. B. Withhold nitroglycerin and notify the healthcare provider immediately. Rationale: nitroglycerin is contraindicated within 24 hours of sildenafil use because the combination can cause profound, potentially life-threatening hypotension. Question 44. A nurse is caring for a client taking digoxin. Which new assessment finding should the nurse recognize as the earliest indication of possible digoxin toxicity? A. Loss of appetite and nausea. B. Severe peripheral edema. C. Productive cough. D. Elevated body temperature. Answer. A. Loss of appetite and nausea. Rationale: early manifestations of digoxin toxicity commonly include anorexia, nausea, vomiting, and general malaise before more severe cardiac manifestations develop. Question 45. A client taking metoprolol has a blood pressure of 90/54 mmHg and a heart rate of 48 beats/minute before the scheduled morning dose. Which nursing action is most appropriate? A. Administer the medication because the client has hypertension. B. Hold the medication and notify the healthcare provider. C. Administer half of the prescribed dose. D. Encourage the client to drink coffee before taking the medication. Answer. B. Hold the medication and notify the healthcare provider. Rationale: significant bradycardia and hypotension are indications to withhold a beta blocker and notify the healthcare provider. Question 46. A client prescribed a nitroglycerin transdermal patch asks why the patch should be removed for several hours each day. Which response by the nurse is most accurate? A. It decreases the risk of skin irritation. B. It allows a nitrate-free interval to prevent medication tolerance. C. It improves kidney function. D. It prevents rebound hypertension. Answer. B. It allows a nitrate-free interval to prevent medication tolerance. Rationale. Continuous nitrate exposure leads to tolerance. A daily nitrate-free interval helps maintain the medication's anti-anginal effectiveness. Question 47. A client taking digoxin develops ventricular dysrhythmias and severe hyperkalemia following an intentional overdose. Which medication should the nurse anticipate administering? A. Digoxin immune fab. B. Adenosine. C. Atropine. D. Epinephrine. Answer. A. Digoxin immune fab. Rationale. Digoxin immune fab is the antidote for life-threatening digoxin toxicity, especially when associated with serious dysrhythmias or significant hyperkalemia. Question 48. A client receiving propranolol asks why the medication should not be stopped abruptly. Which response by the nurse is most appropriate? A. Stopping suddenly may cause rebound hypertension, tachycardia, and myocardial ischemia. B. Stopping suddenly causes severe hypoglycemia. C. Stopping suddenly permanently damages the kidneys. D. Stopping suddenly causes immediate heart failure in every client. Answer. A. Stopping suddenly may cause rebound hypertension, tachycardia, and myocardial ischemia. Rationale. Abrupt withdrawal of beta blockers can produce a rebound increase in sympathetic activity, increasing the risk of angina, myocardial infarction, and severe hypertension. Question 49. A client receiving intravenous nitroglycerin for acute coronary syndrome reports a severe throbbing headache. Blood pressure is 118/72 mmHg, heart rate is 76 beats/minute, and chest pain has improved. Which nursing action is most appropriate? A. Discontinue the infusion immediately. B. Reassure the client that headache is a common effect of nitroglycerin while continuing to monitor. C. Double the infusion rate. D. Administer another nitrate preparation. Answer. B. Reassure the client that headache is a common effect of nitroglycerin while continuing to monitor. Rationale. Headache is a common vasodilatory effect of nitroglycerin and, in the absence of hypotension or other concerning findings, does not require discontinuation of therapy. Question 50. A nurse is caring for 4 clients receiving cardiac medications. Which client should the nurse assess first? A. A client taking atenolol with a heart rate of 60 beats/minute who reports mild fatigue. B. A client taking digoxin who reports nausea, confusion, yellow-green visual halos, and has an irregular apical pulse of 48 beats/minute. C. A client using a nitroglycerin patch who reports a mild headache relieved with acetaminophen. D. A client taking metoprolol whose blood pressure is 112/70 mmHg and heart rate is 66 beats/minute. Answer. B. A client taking digoxin who reports nausea, confusion, yellow-green visual halos, and has an irregular apical pulse of 48 beats/minute. Rationale. This client has multiple classic manifestations of severe digoxin toxicity, including marked bradycardia, dysrhythmia, gastrointestinal symptoms, confusion, and visual disturbances, requiring immediate assessment and intervention. Thanks for watching. If these questions helped sharpen your NCLEX clinical judgment, keep practicing with more high-level question sets. Stay consistent, keep challenging yourself, and you'll be one step closer to passing the NCLEX with confidence. Good luck, and see you in the next video.